Whether it is someone's best day, their worst day, their first day, or even their last day on earth, certified registered nurse anesthetists are there. I chose to become a CRNA because I believe in the healing power of nursing, and I believe it is the greatest honor of all to be a patient's advocate when they're at their most defenseless and vulnerable states of life. From all of us at Northeastern, happy CRNA Week.
I chose CRNA to learn the art of giving anesthesia, as well as to learn some alternative pain management techniques such as epidurals and nerve blocks.
Hi, my name is Zach, and I chose to pursue the CRNA profession so that I could utilize all of the ICU skills that I've acquired over my career so that I can provide a safe, comfortable, and healing environment for my patient before, during, and after critical surgeries.
My name is Katie Ravanola, and I'm a CRNA student at Northeastern University in the class of 2023, and I want to be a CRNA to make patients feel comfortable when they're going to have anesthesia and to provide safe and effective anesthesia care.
Hi, my name is Ariane Lundberger, and I'm part of Northeastern University's DNP Nurse Anesthesia program. I want to be a CRNA because I want to be a provider that can help patients feel safe and comfortable before they undergo surgeries or procedures.
I like being a nurse anesthetist because I get to help people. I get to collaborate with other clinicians and other specialties, and I get to work with the newest, fanciest technology. What's there not to like?
I'm becoming a CRNA because I wanted to advance my degree while building off of my critical care background. As a CRNA, I'll have a complex and challenging job that still allows me to provide a one-on-one patient-provider experience.
Hi everyone, my name is Gabby and I want to become a CRNA because I want to have the opportunity to provide care and to be a source of comfort for my future patients during times in which they feel most vulnerable.
To be a CRNA, when I was a new grad nurse, I was a part of a code where we could not get the patient intubated, and the CRNA showed up, very calmly took in the whole scene and intubated on the first try, totally changing the trajectory of the code. And that's when I decided I wanted to be that calm, cool, collected person at the head of the bed and hopefully save someone's life someday.
My name is Nate Kozlowski, and I want to be a CRNA in order to push myself and be challenged to learn advanced concepts and techniques unique to the field of anesthesia, and ultimately translate those skills into effective patient care.
I am becoming a CRNA in order to further my learning with critically ill patients, become a leader, and ultimately practice at the highest level possible in my profession.
Hi, I'm Janet Dewan. I am currently on faculty at Northeastern University. I've been a nurse anesthetist for over 40 years, and my entry was really fortuitous. It's been a very rewarding career, but I never intended to be a nurse anesthetist. I was very interested in public health and had gone to a master's program in nursing. I went off to Africa with a colleague during one of the drought relief programs. I worked with an international team there, and it happened that they desperately needed a nurse anesthetist at the hospital, and I was the only person available who had intensive care background. So I did spend 3 or 4 months there acting as the hospital anesthetist with a single surgeon in the hospital, French surgeon, and they showed me how to do spinals, and the French nurse anesthetist who'd been there before me left me little index cards with the dosing for pentothal and stuff on them. It didn't seem too hard in a country where the life expectancy was 36 and everybody was extremely thin because of the drought. And I was quite surprised when I returned to America and found out you had to go to school for 2 years to be a nurse anesthetist. But I did resolve to do it, and have never regretted it. It's a wonderful career. Thank you.
I want to be a CRNA because I want to be able to practice with advanced knowledge, but also with a great hands-on skill set, which would allow me to be very reliable and valuable in almost any situation.
I want to be a CRNA because I want to be a provider my patients can trust when they're feeling the most vulnerable.
I want to be a CRNA to continue strengthening my role as a patient advocate.
Hi, my name's Caroline. I wanted to become a CRNA because I really like pharmacology and physiology, and I felt like this career was a good way for me to expand on my critical care background in both of those areas. But I also wanted to become a CRNA because I knew I wanted to stay at the bedside, and the reason for this is because I feel like you can take what you learn and directly apply it and see the results in real time, and that is just so satisfying. So those would be the main things that drew me to a career as a CRNA.
Hi, I'm Sue Hall, and why did I want to be a nurse anesthetist? Well, when I was in nursing school many years ago, I shadowed a nurse anesthetist in the operating room. I was immediately struck by the combination of art and science, the art of nursing, caring for a patient at a very vulnerable time, and having a very meaningful connection with them, and being their support and advocacy, in combination with understanding science of anatomy, physiology, pharmacy, and how that all interplays together for a safe anesthetic for a patient, and for pain control afterwards as well. Once I became a CRNA, I realized that it is even so much more. Not only are we skilled and we make these meaningful connections, but we really have a global view of the patient and bring the art of nursing into anesthesia every single day. So thank you for asking me why I wanted to be a nurse anesthetist. The best decision I've ever made. It's my identity, and I am so proud.